We will get through this together, and we will heal our land. So thank you all very much.
Well, good morning, everyone. Thank you, Vice President Pence, for your leadership of the Coronavirus Task Force. And to the task force members here today, Administrator Verma, Administrator Gaynor, General Sanford, Dr. Redfield, my buddy, Ben Carson, and one of my mentors, Dr. Fauci. Thank you so much for the work that you have all done. It's been a marathon. And the last couple of miles of a marathon, as the Vice President says, are always the hardest. But by golly, the finish line is in sight. So we just got to keep on running. American people, we need you to keep on running. We're going to get there. We have our research community, as well as the tens of thousands of study participants across the country, to thank for showing us that there is a light at the end of this tunnel. And I have to acknowledge the many people of color represented among the researchers who developed the vaccine. Shout out to Dr. Corbett at NIH, an African-American female who helped develop these vaccines. Thanks to the scientists and doctors who reviewed it, particularly those of color, and the study participants who bravely volunteered to demonstrate its safety and efficacy. And Dr. Fauci and I have been working for months to make sure the trials are representative of the population so that everyone can feel safe getting this vaccine. Professionally and personally, to everyone who has made this day possible, thank you with all of my heart. As a practicing anesthesiologist at Walter Reed Hospital, a frequently deployed member of the U.S. Public Health Service Commission Corps who's helped stand up multiple COVID-19 testing sites, and an individual with asthma and high blood pressure, I am acutely aware of my own increased risk for COVID-19 exposure and the comorbidities that increase my risk of complications. And as the U.S. Surgeon General and a Black man, I am equally aware of the symbolic significance of my vaccination today. As I've discussed with faith leaders as recently as last night, the creation of these vaccines is a gift from above. But vaccines, even ones that are 95% effective, will not alone end this pandemic. We must now do the necessary work to go from vaccines to vaccinations. It would truly be the greatest tragedy of all if disparities in COVID outcomes actually worsened because the people who could most benefit from this vaccine can't get it or won't take it. Working to combat mistrust and misinformation will be critical if we are to ensure the equitable protection of all Americans against COVID-19. Lack of trust, especially in communities of color, is not without good reason. The shameful Tuskegee experiments occurred within many of our lifetimes. To truly promote confidence in these vaccines, we must start by acknowledging this history of mistreatment and exploitation of minorities by the medical community and the government. But then we need to explain and demonstrate all that has been done to correct and address these wrongs. The many protections and safeguards in place, like the Office of Human Research Protections, independent institutional review boards, data and safety monitoring boards, the FDA VRBPAC, and the CDC Advisory Committee on Immunization Practices. These are all there to make sure tragedies like the Tuskegee syphilis experiments or the exploitation of Henrietta Lacks never, ever happen again. And finally, we've got to engage trusted voices, medical organizations like the National Medical Association and the National Hispanic Medical Association, faith leaders, and minority gatekeepers like the historically Black colleges and universities, the Divine Nine, tribal leaders, and the National Conference of Hispanic State Legislators, all of whom I've spoken with frequently and as recently as this week. Because when these gatekeepers are informed and confident, their communities will be informed and confident. I want to close by saying I know the importance of representation. Many of you have heard me tell this story. I never believed I could be a doctor, much less the Surgeon General of the United States, because I'd never met another Black doctor, even though I had straight A's. The first doctor I met of color was Dr. Ben Carson when I was in college. It took me that long to believe that I could be it because it took me that long to see it. And that's why I could not be more pleased or feel more called to receive this vaccine that so many people of color had a hand in developing and testing, and that has the potential to correct at least some of the health disparities this pandemic has unveiled. And finally, to all the people of this great nation, it is not only okay to have questions about a treatment that you're being offered, it's normal, and I want you to understand that. But what is not normal is to let misinformation or mistrust cause you to make a decision that is bad for your health. So I promise I will keep working. I'll keep working day and night to make sure you get your questions answered and to restore your trust. I got the facts, and I made a choice to protect my health. When it's your turn, I need you to be informed, and I need you to make a choice that's going to be appropriate for your health. Thank you so much, and I'll turn things over now to Dr. Fauci.
Thank you very much, Jerome. Mr. Vice President, Second Lady, Madam Pence, Jerome, thank you. I really feel extraordinarily privileged and honored to be with you here today to make a few comments about a most extraordinary undertaking that you see here today, culminating in something that is an actionable intervention that will get us out of the extraordinary experience that we've had over the last year. As I was sitting here listening to the remarks of Vice President Pence and Jerome, I was looking over at Bob Redfield and recalling that it was about a year plus a few weeks that Bob called me up one evening at home and told me, I think we have a problem. I'm getting information from my sources in China that there is something very unusual going on there, and I'm very concerned about it. Literally, a week and a half later, the effort that led to where we are today to see the Vice President of the United States and the Surgeon General get vaccinated with a safe and effective vaccine, literally a few days after that, the work began to develop the vaccine. And what we saw was the marriage between years of fundamental, basic, and clinical research that led to the extraordinary technology that have allowed us, and when I say us, I mean the medical community, so many people from so many different agencies in academia, in government, and in industry, to do something that is truly unprecedented. So we started literally days after that phone call that I had with Bob, and over a period of months, as opposed to years, we saw the development in record time of a vaccine that is shown to be safe and effective. We want virtually everyone eligible to get this vaccine ultimately. Two questions get asked when people have hesitancy or reluctance to get vaccinated. Did you go too quickly is the first. The answer to that is the speed was a reflection of extraordinary scientific advances and did not compromise safety, nor did it compromise scientific integrity. The next question is, okay, but what about the fact, is it really safe and is it really effective? Or is this something the government is trying to put over on us? Is this something the companies want to take advantage of? Well, let's take a look at what's happened over the past few months. We've had clinical trials, and thanks to the volunteers in that trial, in tens of thousands who have put themselves on the line to prove to the country and the world that these are safe and effective products. The decision as to whether or not it's safe and effective was not in the hands of the company, nor was it in the hands of the administration. It was in the hands of independent body of individuals, scientists, vaccinologists, ethicists, statisticians, to examine the data independently and say it is ready to look at for approval, at which point the company submits it to the FDA, and together with the advisory committee of the FDA, make the decision it is now ready to go. So the process was independent and totally transparent, which brings us to where we are today. This important symbolic vaccination of the Vice President of the United States and the Surgeon General of the United States, which is something we want to be symbolic, to tell the rest of the country the time is now to step to the plate, and when your time comes, to get vaccinated. Because when we're speaking to you here today, I often say it is really bittersweet. The bitterness is the fact of what the Vice President mentioned. We still are in the middle of a very difficult situation with record numbers of cases, hospitalizations, and deaths. But the sweetness is the light at the end of the tunnel, which I can tell you, as we get into January, February, March, and April, that light is going to get brighter and brighter, and the bitterness is going to be replaced by the sweetness. And we all hope, and I think this is doable, that by the time we get to several months into this year, we will have enough people protected that we can start thinking seriously about the return to normality. And that's up to all of us to step forward and get vaccinated. Thank you.